How about now?
Yes, we can hear you now.
Okay, great. Okay, so let's get started. So University Hospitals Physical Medicine and Rehabilitation is located in Cleveland, Ohio, as you can see from the opening slide. We are a 10-year ACGME accredited program. Originally, we were an AOA program that completed the single accreditation system transition merger. We are the official healthcare partner of the Cleveland Browns. We are actually right now we're the only PM&R program in the entire country that has the added piece of the ACGME osteopathic recognition. So that makes us unique in that regard. We have multiple integrated osteopathic training programs in our system. So that includes traditional, like a transitional year internship. We have a derm program, family medicine, IM, ortho, osteos, PM&R. There's a couple of fellowships as well, sports medicine and allergy. So I guess we'll start with, people are all over the country, and they're thinking, have I ever been to Cleveland before? Is this like a nice place to live and that sort of thing? Obviously, this is a weird year. You're not going to be able to, probably visit in person because we're all doing virtual interviews and that sort of thing. So let's talk about Cleveland. So obviously we're in the Midwest, like the cost of living is pretty good. The school systems are really good, especially in the suburban area. Obviously we're on, Lake Erie. That's a picture of my boat and a lot of my residents there. Shan's the chief resident that's clicking the slides for us, and she only got mildly seasick that day, so that was good. But so we have a lot of professional sports teams. We have obviously the Browns, we have the Cavs, we have the Indians, and that's some of the things that we have as far as that goes. We have a big Broadway kind of area. Once COVID's over, you can start going to shows again. It's one of the biggest Broadway places outside of New York City. We have the Cleveland Zoo. We have the Rock and Roll Hall of Fame, which is a really cool place if you've never been before. We have a big METROPARKS system in the surrounding areas around Cleveland, which is great because you can be, downtown, but then like 20 minutes outside of town, you're like in kind of like the middle of nowhere, which is really nice. We have a national park as well down in Cuyahoga Valley. So in a nutshell, Cleveland is a cool place to live. And, I've been here now 13 years and really like it. And I think a lot of the residents enjoy being here too, as far as, when they're not at work. So the next question would be, are you coming to train at a top-ranked healthcare system? So when U.S. News and World Report, they do their best of the best rankings. We are ranked in multiple specialties. You can see the list there. Some of the ones that come in handy for us are obviously like the orthopedics, the neurology, the neurosurgery, the geriatrics, some of the cancer rehab as well. So we are one of the top 10 hospital systems in the United States, outperforming other peers by a wide margin, as ranked by Thomson Reuters. That's stuff like, having less complications and those sorts of things, standard of care and whatnot. So obviously the flagship for our system is at the main campus, which is University Cleveland Medical Center. So we've obviously, that's like our headquarters location. We have Rainbow Babies and Children's Hospital, which is ranked in one of the top children's hospitals in the country. It's the only level 1 trauma for peds in Northeast Ohio, and is like the top ranked NICU in the whole country. So, obviously with all the stuff that's been going on with the transition from AOA to ACGME and with COVID and whatnot, there's been a lot of economic changes. Some training programs, hospitals have been forced to close. So you want to know you're coming to somewhere that's financially stable. So our system over the past decades had like a $1 billion investment to improve access to healthcare across Northeast Ohio. We have a 200-bed freestanding cancer hospital at the main campus. We've had, CUYAHOGA Medical Center, which is on the east side suburbs of Cleveland, which is right next to our main 50-bed rehab facility. We had like an initiative called Transformation, where they looked at impact on medical education funds and looked at growing access in the community, primary care, and even going out to the rural sites and having physician retention as well. So our program is based at regional hospitals in the UH system, which is located in Richmond and Bedford, which are suburbs right outside of Cleveland. We have our programs that are based in the community. Like I said, historically, those were osteopathic programs. Now they've all converted to ACGME. We have a podiatry program as well. We wanted to have like a program that kind of has the best of both worlds. It has access to the urban environment in the urban locations. It also has training in like the suburban rural community as well. So basically our program started back in 2015. I became the program director in 2016. We just had our third class of graduates that have all been real successful so far. We have a rural initiative where we do have some exposure to, like I said, not only the urban, but also the suburban and the rural areas as well with that kind of access. Basically, they had a campaign, they raised, $1.5 billion to fund all these sorts of projects and that sort of thing, and which is great. So, kind of like what does our system value, like who are all of our academic partners and what's the environment of the program you're going to train in when you come here, hopefully. So obviously we value excellence, we value diversity. You can look at the Facebook pictures of all of our residents in our program, current and past. We've had, all sorts of people, all sorts of, backgrounds and that sort of thing, which is great because I think that that's something that we're pretty proud of. We have obviously want to have compassion and empathy for those that are in our community and working as a team, which we want to get team players, So speaking of team players, we have multiple academic partners that we kind of tap into for various things. We work with Cleveland Clinic, Metro Health. We work with our local VA in Cleveland. We do pediatric stuff through Akron Children's. And our academic partners are for osteopathic is Lake Erie College of Osteopathic Medicine and then Case Western local. So there's some of the fun things we do, whether it's, bowling or axe throwing or top golf or going to movies or whatever. We have, off time, social time. So I think that people tend to, work hard, but also have fun as well. It's a nice, friendly, fun, diverse group. And like, obviously there's always time, for a family. We went into PM&R and not like, neurosurgery or something like that. So for education, obviously, like I mentioned, we're the only osteopathic recognition program in the country. So that's obviously integrated as a part of our training. We have a lot of alternative, integrative aspects of that as well. We've had several residents that have done the University of Arizona Integrative Fellowship as a resident in training. And, the program is obviously growing, so it's flexible as new opportunities come in. We make changes as we need to, and that's what I would say about that. So as far as scholarly activity goes, that's a picture of, one of our chief residents, Shannon, there at the ACGME annual conference speaking. She also served on the osteopathic recognition committee for ACGME when they do the site visits and that sort of thing. So definitely we have like an annual research symposium. We have training in research methods that runs through Case Western when you're a PGY2. And we have a research focused grand rounds that happens every July. And then usually people usually they do like some sort of osteopathic type of scholarly project, maybe when they're like a first year, and then, by the time they're like a third year, fourth year, they're working on like a academy project, whether it's AAP or AAPM&R. So who are we as faculty? That's a picture of me. So I'm the program director. Like I said, I've been here 4 years, board certified in PM&R and sports med. So Sarah Pastoriza, she is our new associate program director. She's actually done 2 fellowships, pain and also like a regenerative orthobiologics. So it's really cool. She's going to bring a lot of stuff to our program. Michael SCHAEFER, he is our division chief. He came to us from the clinic, Cleveland clinic that is, and he is also boarded in PM&R and sports. Dr. Gazzillo is new to our program. He just recently completed a interventional spine fellowship program at the clinic. Dr. Trickett, she's the CMO for our Parma facility, which is like a community-based ARU. So you get trained in like an ARU setting as well as like a freestanding setting. Dr. Sorrells, she came to us from Spalding, and she has clinics like ambulatory PM&R in multiple locations on the east side of Cleveland. Dr. Arsenault, she is our main EMG faculty down at the VA. And then those are some of our other doctors as well, Dr. Gherkins and so on. So as far as curriculum goes, we have a didactic system that is set up. Now granted, we're like a 4-year program, so we are a categorical program. So usually the PGY1s, they focus didactics on, getting ready for like their step 3, doing various procedural training workshops, that sort of thing. We have an osteopathic grand rounds that we do as a consortium when it's not COVID-19, where we all get together in like a big room and set up tables and do some, muscle energy or those sorts of things. So right now, that's obviously more of a small group type thing. As far as the main core conference series, we recently kind of entered into an agreement with the other programs in town, which is Metro and Cleveland Clinic, where we're doing like a joint virtual didactics, partially because of COVID, but then the plan is for that to continue even post-COVID. I think that all the residents will meet at the Metro site, and the cool thing about that is that you'll get the experts in various subspecialties kind of tapping into the faculty from all 3 institutions coming into our didactics jointly, which is real exciting for our program, and I think for their programs as well. As far as skill development, obviously you're going to have the clinical, whether it's doing, MSK ultrasound or injections, but also like, there's pictures there of some of the alternative stuff, whether it's like acupuncture or, like OMT. So as far as rotations go, we have multiple sites. I mean, this is definitely a residency that you're going to need a vehicle to travel. I mean, it's not all like in like one giant downtown hospital. So we have our regional hospitals. We have our rehab hospital, which is a 50-bed freestanding in Beechwood. We have our main campus downtown, CMC. And then we also have various, health centers that are kind of scattered about, plus the peds like I talked about earlier. So as a PGY1, we have kind of essentially, it's like a transitional year like curriculum.
Dr. Connell, I just wanted to give you a 5-minute warning.
Sure, thank you. So we have like a transitional year type curriculum, which is good. Dr. Tangen, he is our program director for transitional year, so you work with him a lot as a PGY1. You can look there, that's our general gist of what happens as a PGY1. You do a month of kind of like intro to rehab as well. And we do, the IM service at Richmond and Bedford, ICU at CUYAHOGA, and that sort of thing. And then PGY2, we do our stuff at the rehab hospital and our ARU at Parma. We do spinal cord injury at the VA. We do various ambulatory clinics. We do peds at Akron Children's, like I mentioned earlier, or Cleveland Clinic. And then we do those other things as well. So that's a picture of our 50-bed rehab hospital, which is a freestanding in Beechwood, Ohio, which is like, on the east side of Cleveland. And we do all the stuff, that you would usually do at a level 1 trauma freestanding rehab. Kind of blow through all this, I think, Shannon. These are like the other programs that we have that are based in our UHOC consortium. I think this whole program is maybe available if you want to look through it later, like on your own time. Obviously, we follow ACGME guidelines for vacation and CME. Usually everybody, now, when you can actually go to an in-person convention again, everybody attends, AA, PM&R, or AAP at least once during their residency, and there's an educational stipend provided for that. Obviously, people get evaluated. We have an electronic-based evaluation system. We have residents that not only get trained, but also teach med students as it's part of the expectation as well. So in summary, I think that we have a growing, readily accessible core faculty. Can really tap into a lot of clinical faculty in the region. Comprehensive joint didactic program, like I said, now with Metro and the clinic, you get exposed to a lot of different populations, whether it's urban, suburban, or rural. And keep in mind, like I said, we're an osteopathic recognition program, so by no means is it limited to DO applicants. But if you're an MD applicant, you should have at least I would say a certain interest in osteopathic philosophy and that sort of thing, because that's going to be part of the training, part of the program. And like it says, we like each other, we have fun, which is what's important. So as far as what we look for, we want to have team players that have a positive attitude, motivated, and want to make a difference, right? And I think that we offer a supportive environment, challenging curriculum, increasing responsibility, opportunities for growth, success, and an outstanding healthcare system. So that's it. Any questions at all? I see one down there. It says, can you please elaborate on any international? If you mean like away rotation, like an international rotation, we've never had anybody do that in our program as of yet. And I think that for that to happen, it has to get approved by like our university hospital's GME. So I don't think it's impossible, but I mean, like I said, we've just never had anybody do like an international away rotation as of yet. Any other questions? Okay, well, if not, I thank you everybody for your time. And like I said, oh, I see one more question. Oh. It says, what's the length of your rotation blocks? Yeah, so it varies, right? The length of rotation of our blocks. Usually when you do inpatient rehab, you might do, like a block of like 3 in a row or something like that. A lot of the elective not elective, but like a lot of the specialty rotations are usually like maybe like 1 or 2 blocks. Can't think of anything that's usually more than maybe like 3 consecutive blocks. So. Let me click on the chat to see if I missed anything. It says, are there any fellowships in the system? Right now, they're working on starting a non-accredited spine fellowship that I think could possibly be ready as soon as like next year. So that could happen. I see where it says, tell us a little about research opportunities. Do most residents do case studies or more developed stuff? Well, in the past, historically, a lot of our residents have done, like poster presentations at the academy. A lot of times those have been case studies. We have had people do a lot of QI projects. And that's one of the exciting things. Like I said, now we're going to start working more collaboratively with Metro and the clinic, and I think historically they've had, especially Metro's had a lot of more like basic science type research. So I think we're going to start to have more access to that type of stuff as well. But keep in mind, our program is like a community-based program. So my focus is really on training like people to be excellent like clinical physiatrists as compared to maybe being like a, you know, primary researcher type physiatrist. But I think that research is definitely available.
All right, Dr. Parnell, we're out of time here.
Yeah.
If you want to leave your email, if they could send you questions, feel free to
Yeah.
do that.
Yeah, that would be great. Yeah, we can certainly do that. And you know, and people can you know, shoot me questions or whatever.
Thank you so much, Dr. Parnell, and everyone from University Hospitals.